Hello everybody, my name's Susie Wilson. I'm the director of the Clod Ensemble and of the Performing Medicine programme. Performing Medicine creates courses for healthcare professionals and students to support them to provide excellent care. We work with a range of really inspiring associate artists. They're coming from photography, from theatre, from architecture, from visual arts and from dance. And they're helping healthcare professionals to develop really specific skills that they need in their clinical practice. So skills around self-care, how they look after themselves, non-verbal communication, verbal communication, spatial awareness, leadership, teamwork, how to appreciate the person that's standing in front of you, their circumstances, their narratives, whether that person is a colleague, a patient, or a carer of a patient. Over the last 10, 15 years, we've worked with around 12,000 healthcare professionals, and we've built partnerships with medical schools and NHS trusts across the UK, including Barts and the London Medical School, King's College London, the Royal United Hospitals in Bath, and more recently, Guy's and St Thomas's Trust, where we've been doing a project for 4 years. Our work is funded by Guy's and St Thomas's Charity, by the Wellcome Trust, by the Arts and Humanities Research Council, by the Arts Council in Wales and in England. So there is this kind of recognition from both the arts and the health education sector that this work is valuable. We're building the evidence base. Our research is sought after by people who are working around advocacy for this work and also around policy change. Which is very important, as we've heard. We work with nurses, doctors, with porters, with administrators, with consultants, with sonographers, with anyone who works within healthcare and social care contexts, which have very specific emotional, physical, and intellectual demands. Healthcare is an incredibly physical, practical, interactive profession, and so our approach is very physical, very practical, and very interactive. We're interested in what care looks like and feels like. So we know that the vast majority of healthcare professionals feel very caring, but feeling caring isn't enough. It needs to be demonstrated, it needs to be enacted, and it needs to be embodied. And these type of methodologies give people the opportunity to rehearse, to make mistakes, to improve, to change, and to make people feel like they have some agency in an environment which often feels quite disempowering and overwhelming. Our work concentrates on the details, the tiny details. We're interested in the small moments, the brief encounters that happen every day between health professionals, patients, their colleagues, and their carers.
So my name's Peter Jay, and I'm a consultant in emergency medicine at St Thomas's Hospital. And 4 years ago, I was lucky enough to start collaborating with Performing Medicine, designing, delivering, and taking part in courses. Working with people from different disciplines is invaluable, giving you a different perspective, allowing you to see things that you might be blind to, and as a result, improve the quality of care that our patients experience. One of the major ideas from this work that's changed my practice is that it's as important to look after myself and my colleagues as it is my patients. That might sound obvious to you, but it's an epiphany for me. It's not the culture of the NHS, where, under severe pressures, we focus more and more on the patients and forget to look after ourselves, causing increased burnout, sickness, and leading to poor quality care. So now, I think of my body and my voice as a precious resource that I must look after, that I need to warm up and down for work. Understand that my self-care and that of my colleagues is directly linked to the experiences of our patients. As part of our collaboration, we've developed a framework to describe a unique set of skills that impact on the patient experience, and it's called the Circle of Care. Encouragingly, this model's been really well received by staff at all levels of our trust and beyond. And we already have the support of our chief nurse and the head of our HR. Excitingly, it's just starting to contribute to what we all aspire to, a shift in the culture of the NHS.